Good morning everyone. Today's topic of discussion is dry eyes. Is it a price to pay for clear skin? There was no financial support and sponsorship and no conflict of interest. Acne vulgaris is a chronic inflammatory disorder of the pilosebaceous unit affecting 9.4% of the world's population. For severe acne, isotretinoin is the drug of choice. Although it is the most effective drug available, it affects the skin, mucosa, eyes and other systems as well. As meibomian gland is a differentiated sebaceous gland, isotretinoin can lead to meibomian gland dysfunction resulting in dry eyes. Thus, examination of dry eye parameters needs to be done to find its association with oral isotretinoin use. The aim of my study is to comprehensively analyze the association of dryness of eyes in patients on isotretinoin therapy and to assess reversibility after completion of treatment. It was a prospective longitudinal study from January 2023 to June 2023 and the sample size being 50 patients. We had included patients aged 18 to 40 years with severe nodular cystic acne and on isotretinoin therapy, and we had excluded patients receiving other hormonal therapies notorious of dry eyes, having other systemic conditions like Sjogren's or thyroid, using topical drugs affecting ocular surface, patients having history of previous trauma, ocular surgery, contact lens use, or with prolonged screen time. Using the above criteria and after taking this informed consent, 50 patients with nodular cystic acne were included in the study, and their ophthalmic evaluation was done with emphasis on tear film breakup time with its normal values being more than 10 seconds and Schwammer's test 1 with its normal values being more than 15 millimeters in 5 minutes. 3 readings were taken. One was at the baseline before the treatment initiation, next was after 3 months of isotretinoin use, and the next was after 3 months of treatment cessation. This is the tabulated data of the 50 patients with the TBUT values. On the frequency polygon, we can find that 2 out of 50 patients had below normal TBUT values at baseline. It increased to 27 out of 50 patients after 3 months of treatment, and it reduced to 15 out of 50 patients after treatment cessation. This is the pie chart showing the same in percentage. On calculating the mean, the baseline TBUT was 13.42 plus minus 3.08 seconds. After 3 months of isotretinoin use, it reduced to 9.86 plus minus 3.36 seconds, and after treatment cessation, it increased to 11.67 plus minus 3.70 seconds. These are the data of the Schwammer's test 1 of the 50 patients. And on frequency polygon, we found out that 10 out of 50 patients had below normal Schwammer's values at baseline. It increased to 36 out of 50 patients on treatment, and it reduced to 32 out of 50 patients after treatment cessation. This is the pie chart showing the same in percentage. On calculating the mean, the baseline Schwammer's was 17.02 plus minus 4.60 millimeters. After 3 months of isotretinoin therapy, it reduced to 11.5 plus minus 3.96, and on therapy cessation, it increased to 12.6 plus minus 4.96. Thus, the results showed significant decrease in mean TBUT and Schwammer's values during treatment with a slow increase in the parameters after discontinuation. Thus, this study infers that oral isotretinoin therapy for acne can cause dry eye disease and the effects are reversible to some extent. Studies revealed isotretinoin affect meibocyte differentiation and causes changes in meibum through PPAR gamma pathway. Larger studies considering the ocular clinical features as well as other diagnostic tests are required to further authenticate these statements. Thus concluding, results suggested a positive correlation between dry eyes and oral isotretinoin use. And my take-home message will be awareness among healthcare professionals and patients regarding the potential ocular side effects of isotretinoin is crucial for early detection, appropriate management, and optimization of patient care. These are my references. Thank you.
Were there any previous studies which did the same?
Yes, ma'am. There were few. Yes, ma'am. There were few studies done previously on this
same thing.
Yeah. Yes.
And what were their results? Did they find a similar picture, or were there any different?
No, ma'am. There was somewhat similar picture, but the Schwammer's values were it did not decrease while on therapy, but in mine it showed reduction.
In your discussion, you need to usually include what the previous studies said and how your studies agree with the same or differ from the previous studies. Okay?
Okay.
Good presentation.
Thank you.